I think you guys are good.
Okay, hello everyone. Thanks for coming to another virtual shadowing session with Fresh Dental Shadowing. Today we have the wonderful Dr. Alexis Linnebur, who is an oral and maxillofacial surgery resident. So you go right ahead whenever you're ready, Dr. Linnebur.
All right, so hi everyone. I am happy to talk to you guys. I know that the last time you had somebody talk to you was also an OMFS resident as well. I believe he is in New York and he's a first year. So I am currently in my third year, so I'll have a little bit more experience to talk about. But I really wanted to just talk to you guys about the full scope of oral surgery and really what we do. I think a lot of people are still kind of confused and don't really know what we do and what we're allowed to do. So in this picture is my current residency, the front two people right here, and then these two gentlemen in the back are my attendings, and everyone else is my co-residents. Okay, here we go. So today I'm going to talk to you guys just about my background, my specialty, just a little bit about my residency. Of course, everyone's going to be a little bit biased. Their residency's awesome, so I'll just give you a brief overview of that, and then we'll have some questions at the end. So again, my name is Alexis Linnebur. I'm an oral and maxillofacial surgery resident at Carle Foundation Hospital. I'm currently in my third year. PGY3 is how we depict what year we are. So my background, I did my undergraduate degree at the University of Kansas, so Rock Chalk. I did my dental degree at Midwestern University in Downers Grove, Illinois. There is a sister campus in Glendale, Arizona as well. I was a little bit late in deciding that I wanted to do oral surgery, so that meant that I did an intern year. I did that at Northwestern Medicine in Chicago, and I was also kind of split between University of Chicago, and I went back and forth between the hospitals. And then I matched at Carle Foundation Hospital, where I am currently. So let's talk about my specialty, oral and maxillofacial surgery. This, I truly believe, is a specialty, which is why I chose a specialty, that you can tailor it to really be what you want it to be. You can be you can put yourself into the specialty full force, so you can kind of just be on the sidelines and do some private practice and make an amazing life for yourself. In your training, you can do 4 and 6 year residencies. Your surgical training in those residencies and the competency skills that you have to achieve for both is equal. The difference is in a 6-year program, you really are, you're doing 2 years, you're getting your MD, which is a completely respectable and amazing thing that they do. I just didn't see myself after doing an intern year wanting to do 6 years. And then fellowships, there's subspecialties, the head and neck oncology, cleft and craniofacial, TMJ, plastics, orthodontic trauma, and there's even international fellowships that you can do after your training. So once you finish your training, then what? So you really can do whatever you want. You can be an academic attending, where you are at a university or a hospital-based program teaching residents, taking call, and really promoting the specialty from within. You can do research, you can do solely private practice, and then you can do a combination of all of those. Now, our scope. This is a really hard topic. I think there are books that are dedicated to what we do. This is just a few pictures of what we see very, very, very commonly. You can see implants on the top right, oral cancer, orthodontic surgery, trauma, cleft lip, pathology, and cosmetic surgery. So really, what does it mean that our specialty is so broad? It means that we're responsible for a lot of things. We have to have a wide base of knowledge, from the bones to the muscles to the nerves, the function of the head and neck, because it really does play a role in every single thing you do. A lot of people don't know that you need to be aware of the airway. We do sedations in our clinic. This right here is a very common anatomy that we see weekly when we are doing tracheostomies for patients. The eye, the orbit, when we reconstruct an orbital floor. I mean, these are things that we have to be able to be ready for whatever walks in our door. So we'll start off with dental alveolar. It really is the bread and butter of a specialty. I mean, wherever you go or whatever kind of pathway you take, you're going to be doing dental alveolar more than likely. You see impacted wisdom teeth. I'm sure most of us have had our wisdom teeth taken out. In this middle picture, I don't know if you guys can see my arrow, but right up there is an impacted canine. So an orthodontist would ask you to go and find that tooth, attach a chain, which you can see down here. And that allows them to really pull the tooth down and use that for function. You can see this patient who has a lot of extra teeth. So you'd help out with that. You can see down below vertical augmentation, bone grafting, splinting, and sinus lifts. For disease processes, I mean, there's such a wide range of things we see. Infections, anything that's very simple, especially in residency, you're going to get vestibular abscesses that you have to go into the emergency room in the middle of the night and drain, all the way to really large life-threatening infections that you have to take the patient to the operating room, drain the deep spaces, and make sure that they're stable and really getting better from the bad tooth. These benign processes, if you can see in this panel right here, this is a large cyst. Although it is a benign process, they're locally destructive. That's a meloblastoma that has to be resected and reconstructed so that patient can maintain function. Malignant processes. This is a squamous cell carcinoma of the palate. So that's something that has to obviously be addressed with partial or even a larger maxillectomy. So for functional and reconstructive purposes, in this top, you can see implants. A lot of oral surgeons do implants, and these really, really long ones are zygomatic implants, and those are really reserved for patients who have extreme atrophic maxillas. You just can't get a normal implant in there for them. For traumatic reconstructions, we see MVCs, which is a motor vehicle accident, gunshot wounds, assaults, anything to the head and neck that we have to reconstruct. I mean, those are some of my favorite cases. Orthognathic surgery, you can see down here, all these plates and screws are from somebody who had some disharmony in their skeletal matrix, and they needed the maxilla and the mandible brought into a function that allows them to better masticate or eat and then speak. For trauma, anything of the head and neck that involves hard and soft tissue, we see anything from this simple zygomatic arch fracture up here to this large dog bite, mandible fracture. In the bottom left, you can see a anterior and posterior table of the frontal sinus, where you have to be able to talk with your neurosurgeon colleagues in order to reconstruct that defect. We see cleft lip and palate. These are some of my favorite patients. I just think that providing them a service that they truly will never be able to repay you for is extremely rewarding, and the bond that you can build with the families. I mean, I haven't done a lot, but it's truly amazing. This is a bilateral cleft. This is a craniosynostosis patient that had to go to the operating room. You can see disorders, and then our alveolar cleft, which we will put a hip graft in there to give them more bone so that as they grow, they don't lose those teeth. Cosmetic and TMJ surgeries. You can see blepharoplasty, a facelift, a rhinoplasty, and the bottom, a TMJ, reconstructing the joint and giving the person the function without pain that they've been asking for their whole life. So that is the fastest and most kind of brief, but I tried to be a little bit broad on what our scope of practice is. I think I really could probably talk all day on why I love oral surgery. And a little bit about my residency. Like I said, I'm at Carl. We're a 4-year certificate program. We're fully accredited by CODA. We are a hospital and private private practice-based training program. We provide 24/7 call for OMFS service. So anything of the head and neck will get called for. I love Carl because we don't have ENT residents, plastics, or ophthalmology residents. So we truly do have a full scope and what we see and what we're expected to be able to take care of. Down below, you can kind of see, it's just a mock-up of what your time in residency would look like on a month-to-month. We have 4 interns a year. An intern right here, we would also call a non-categorical intern, and that's kind of universal throughout. Those, along with our PGY1s, are all on service, and then our chiefs are on service as well. And then your second and third years are when you go off service and you do medicine, general surgery, ICU, anesthesia. I'm on trauma right now. My co-resident is, where is he? He's on plastics. So, yeah, you get a wide range of specialties that you get to work with and see what they do. So these are some of the resources that I use just for patient pictures, because I knew this would be on the internet. I didn't want to put any of our patient pictures on there, but they're really a great resource if you're interested in any of the things that you saw. So yeah, any questions?
Okay, thank you so much for your presentation. And anyone who's watching, you could just ask some questions in the chat. I do have some written down here, so I'll just get started. So can you go in a little bit more detail about your internship?
Mm-hmm. So my internship at Northwestern and Chicago, UIC Chicago, was a year for me to build on myself and my application to get myself ready for residency. As an intern, you have the same responsibilities of those that are within the categorical positions. It's basically a year-long training for you to kind of get your feet wet, learn the hospital system, learn what it's like to go into the emergency room and figure out what's wrong, triage the patient, call your senior, come up with a plan, and then do whatever that patient needs. It also gives you time to kind of get more confidence in yourself. That's really what I got in my intern year. It is an extremely hard year. It's residency. You work a ton of hours and you get to know some of your co-residents, and you all struggle together. You fail and succeed together, and you just learn and get ready for applying to residency.
Yeah, for sure. And how do you get into that internship? Do you just apply or?
Yeah, so when I did my internship, I had not taken the CBSC, which is the exam that you have to take to get into oral surgery, just because I was so late. So I just sent emails to every program that took interns. I sent an email and asked, hey, would you consider me? And I think 5 or 6 of them emailed me back. And then I got an interview at Chicago and I signed up with them. But on a more traditional path, if you go through the match system and you don't match, then those programs go through their list of applicants that applied to them and then say, oh, I really liked them. I wish we would have taken them. And then they go and see if they want to do an internship if they haven't matched anywhere else.
Okay, that makes sense.
Yeah.
And then someone asked in the chat, during your residency training, did you get paid?
You do get paid. If you do your 4-year and your intern year, you get paid. In your 2 years of medical school, I think there's one program that will pay you in those 2 years, but otherwise, I think it's pretty universal that you pay for those 2 years of medical school. Yeah, but otherwise, you do get a PGY salary, it is what it is. It's not a lot. You get a little bit of a raise as you kind of get up in the ranks, but yeah, at least it's something.
Yeah, that's better than nothing. So after your residency, are there any job opportunities right away? What's the job market like for this sort of specialty?
The job market is great. I have never known or heard of a resident not being able to get a job. There are always emails that my program director sends out to us. I feel like I got one each week just about places that are looking for new graduates and people that are ready to work.
Wow.
Yeah, it just depends on if you want to do an academic kind of path or if you really want to go into the private practice.
Okay.
Either it's great, yeah.
So you have quite a bit of options then in that kind of way.
And you can also do the kind of combined path. And I think I would like to think that more people would do that, but I really think that most people just go into private practice because it's easier.
Yeah.
You don't have to take as much call.
Oh, sorry.
You don't have to take as much call.
Oh, that definitely helps then, I'm sure.
Yeah.
How hard is it to start your own practice for this specialty?
I would imagine that it is tough, but more it's just expensive.
Oh, okay.
Yeah, it's a lot to kind of create your own practice and build a network, but it's definitely doable. I mean, people are still doing it all the time, and it also plays a factor like your student loans. So I'm sure someone with a lot of student loans wouldn't want to start a practice, or maybe they would. I don't know. I know some people are really, really interested in owning their own business and having their own practice, as some other people just aren't.
Yeah.
Yeah.
Is that something you're interested in?
I'm figuring it out. I'm applying to fellowships right now, and if that doesn't work out, then I will just see what job opportunities are out there.
That's a good way of looking at it, just take it day by day.
Yeah. Sure.
So what inspired you to choose oral surgery or to specialize?
So I went to dental school knowing that I wanted to be an oral surgeon because I had a family friend that I actually, when I was in high school, would babysit for, and he was an oral surgeon. And I remember going to his office one day and seeing a person who had self-inflicted gunshot wound to the face, and he was responsible for reconstructing hard tissue, soft tissue. He had different phases, and there were so many intricate little details that went into really making this person basically have a face again. And I was so intrigued, and I was like, that's what I want to do. I love that. So, and I haven't looked back. Dentistry is great. It also has I just wanted to do surgery. I love doing surgery. And oral surgery, you can do medicine and dentistry. I mean, if you really like taking out teeth and doing implants, you can basically make an entire career out of that and do extremely well for yourself. Or you can kind of be a little bit more into the hospital side of things and manage patients as well.
Okay, so there's a lot of aspects of that.
Yeah.
And it kind of seems like your specialty especially helps people with their confidence a lot of the time, or just with like that sort of thing. So that's really great. And then what's your least favorite and most favorite procedure to do? Interesting question.
That is an interesting question. My least favorite procedure, I think, would be like having to go, even though I don't have to do that anymore because I'm more senior, would have to be like going into the emergency room to drain a vestibular abscess. I mean, half the time it's like 2 a.m. and you have to go in and drain an abscess, and it's not my cup of tea. I would say, I mean, for my favorite, there are so many things that I like. I love everything with cleft lip and palate. I think those surgeries are so intricate, and you have to be so meticulous and detail oriented, because these are little babies. You are taking a little baby that looks one way having a procedure done and then giving the mom their baby back, that looks different. So you want them to look as good as they can when you hand the mom back their baby. And then I do love trauma. I love reconstructing like big pan facial fractures and mandible fractures and that kind of thing.
Okay, so definitely like more than you dislike, which is good.
Yeah, there's really not a whole bunch that I don't like.
And then with that, could you pass off the things like you kind of mentioned? If you don't like it, then you don't have to do it as much now.
Yeah. So when you're an intern, you, at least in our program, I'm only speaking for our program, but you as an intern, you do pretty much almost everything in the emergency room. Granted, you are supervised, and everyone makes sure that it's done the correct way, but you are the one responsible for when your pager goes off in the middle of the night. You go to the emergency room, whether it's a dog bite, an infection, a fracture, whatever walks in that door, you go in and you take care of. And then if it's something that you can't handle or something that you've never seen before or you're just unsure, then you call your senior. And then your senior, so me or one of my other co-residents would kind of drive in, do like triaging, see what needs to happen. And then if it's over our head or something that is even bigger than that needs to go to the OR, we'll call our attending.
Okay.
Yeah.
That's great to have that.
You get to sleep a little bit more.
Yeah. That's always nice. So what are some other things you would have to learn that you don't learn in residency or dental school for opening a practice?
There's a lot of business.
Yeah.
I 100% a business, like having some business background, or my chief who is looking for jobs right now. We just had a discussion yesterday about DSOs and larger corporations, people groups coming in and buying practices and what that means for us as new residents and new graduates, kind of going into the field and working under those entities. And he actually sent me some links and articles that he had been reading. So that's definitely something that I have to learn because we're not taught business anything.
Yeah, I always wondered that, like when people open a clinic or their own practice, how do you learn that part? But
some people are lucky and they can have like their family friend or a parent that is already in the practice, and then they can just learn from them. But
okay, that'd be very helpful, I bet. So I've heard a lot about sinus lifts for implants. Can you describe that procedure a bit?
Yeah, so a sinus lift. So your maxillary sinus is different from your nasal cavity. And a lot of times when people either lose teeth or sometimes for no reason, you get pneumatization of the sinus, which means the sinus membrane will kind of drop. So your Schneiderian membrane kind of goes in between the teeth or falls right where the level of the bone is. And you need so much bone, if you can imagine, to put we'll call it a screw or an implant into that bone. And you can't just put that implant into sinus. That bone actually, or the implant has to be surrounded by bone in order for it to osseointegrate. So what you do is, there's a few different ways that you can do a sinus lift, but you can do a lateral window where you kind of open up a larger area and basically kind of tease the membrane up and stuff some bone in there. And then you have enough bone that you can just drill the implant in. Or some people will do an indirect sinus lift. Maybe you don't need as much bone. So you'll start your implant process and then you kind of, they're called osteotomes, but kind of, I don't know, little hammers that you can kind of like bump the bone up a little bit and then put your implant in.
Okay. Yeah. That's interesting, actually. Are there any, is that procedure a hard procedure or is it pretty simple, I guess?
Yeah, I think they're pretty simple. As long as you do a few and you take your time and don't rush through it, it's pretty straightforward. Yeah.
Okay. And on that note, are there any super hard procedures?
There are a ton of hard procedures.
That makes sense.
Yeah, I would say thing that comes off the top of my head is maybe somebody comes in with a really bad car accident and their fracture is really displaced. So not only are you fighting the bones, putting them back into anatomic position, but you're also fighting the muscle pulls. So each muscle is obviously going to pull the bones in different directions. So you can kind of fight that. And then if you have a lot of comminution or the bones in a lot of little pieces, it can make it difficult to put them back together. But it's fun. It's difficult, but it's fun. It can be so infuriating in the process, but once you like get it, you're like, okay, got it.
Kind of like problem solving in
exactly. You're like putting a puzzle together, and you have to be able to three-dimensionally figure out how the bones go. Yeah, I like those. Those are fun.
That's good. So is the atmosphere of your residency competitive, friendly, bit of both, or what's it like?
That's a good question. And I definitely think for anyone who's interested in oral surgery, that's a question that you should always ask every program, because I think every program is very different, and it can be the nicest program, but it might not be the program that's best for you because you just don't fit in with everyone. My program specifically is really great. We all get along. Of course, we're all competitive. Naturally, we're very competitive people. I think we compete with ourselves the most because we just want to be the best that we can be, but we're always there supporting each other. And if somebody needs help or somebody can't do anything, someone else is definitely there to step in. And because we've been there, we've had hard days, we've had things come up unexpectedly. So we have a really good atmosphere. I'm really lucky for that.
That's really great to hear. And I bet really great to be in as well.
Yeah.
Is there a typical day for you in this field or just in the residency in general?
It does depend on where you are at in your residency. An intern, like my intern year, I was getting to the hospital at 4:40, 4:45. It was pre-rounding on the patients, and then you round with your seniors, and then you either go to clinic or go to the OR, and then your day can end anywhere from like 5 to the next morning. Wow. As a senior, yeah. And then now, I mean, I'm on trauma, so my hours aren't that great. You have really long hours, but at least when you're done at like 6:30 or whenever the last trauma comes in, then you get to go home and you don't have to be on call, which is nice.
It's nice. In that way, there's not really a typical end time then. It's just whenever the last
yeah. There are definitely days where you can get out at like 4:00 if there's no operating room or there are clinic finishes early, but you still have to do your notes at the end of the day. So that can take, depending on how many, maybe like an hour, we'll say. So maybe get out at like 5:30 when you're done with your notes, and then just start the next day. But there are definitely times where you might not get out of the operating room till 8 or 10 at night. Yeah, they're long, but it's fun. I'm always so tired in between cases, and then once I get into the operating room, I forget how tired I am, and then I just do the procedure, and then it ends, and then I'm like, oh my gosh, I'm so tired, and then and I'm like, okay, I have a new breath of air or new wind or something. So
that shows that you enjoy it, so that's good. So has there ever been a procedure where you didn't know what to do or something goes wrong? What do you do, or who do you go to in that situation?
There is always and forever going to be something that you don't know what to do. And don't ever think that when you start something that you should know everything, because if you knew everything, then what's the point of residency? Yeah. I as an intern, I'd call my senior. If I didn't know what to do, that's what my senior is there for. And so that's what I always tell my interns and my juniors, that if you don't know anything, you call me. As for me, I just go to my attending, because that's the next person. If my chief is around, then I'll go to him and ask questions. Otherwise, I'm just going to go to my attending and tell them what's going on and work through it.
So pretty easy solution in most of the time.
It's always stressful because, I mean, you're dealing with a patient, but your attendings are there to also teach you. They wouldn't be attendings if they didn't want to teach you either.
Yeah, for sure. So what's the most exciting part of your job for you? If you were to pick one or two things at the top.
I'm not gonna lie, I wasn't prepared for all of these questions. I truly do love everything about oral surgery. I absolutely love our scope of practice. I love that we are hospital-based, private practice-based medicine, dental surgery. I consider our specialty as surgeons. I don't consider our specialty as dentists. So therefore, I love surgery. I think that's the most exciting thing that we do. And there's always something new to learn. There's always something that you can improve on. And it's always exciting. Of course, there are days that are going to be lulls or something that's not, but there's always something that makes you excited.
Is it kind of like different every day in that case that keeps it exciting?
Yeah, and we take out so many wisdom teeth, but not every. I mean, I can't tell you one wisdom tooth that was just like the last wisdom tooth. Or a mandible fracture that was exactly like the last mandible fracture, or the orthodontic surgery that sagittal split was exactly like the last one. It's a new case, a new procedure for every patient. And I think that's also why it's so exciting, because it doesn't get boring.
Yeah.
You're always challenged. Yeah.
Yeah, that's also very nice, I bet. With that, since you do a lot of surgeries, did you ever have to get used to seeing all the blood, or was that something you were already used to a bit, like never had any troubles with? First time you see like a lot of blood, like when you're in school or you're shadowing, like you see like some blood after an extraction or something, you're like, oh my gosh, that was a lot of blood. And then you do a neck dissection, and then you see, oh, that's a lot of blood. Or you go on general surgery and you get into the belly and go on trauma, and you're like, that's a lot of blood. So I think you just kind of get very used to it. And there's always the saying, all bleeding stops. So all you have to do is find the source and control it, and stay calm, cool, and collected in the chaos. Yeah,
find it. Yeah.
Never had any near faint incidents?
Near faint? Me? Not from blood. I would definitely say maybe like those days where you don't eat and you've been on your feet or you're dehydrated. I think there have been some close calls, but no, not because of the blood.
That's good, though, especially in your specialty.
Yeah. I think you should, if blood's a little worrisome, maybe shadow or watch oral surgeons before you go full speed.
Like expose yourself first. So how much flexibility are you allowed in your job in terms of location, vacation, hours, that sort of thing?
In like residency? Or like
or just after you graduate and get into that specifically?
Yeah, so in residency, again, I think every residency might be similar or the same, at least 3 to 4 weeks of vacation per year. I think you get maybe a few days for vacation, or not vacation, for conference days if you go to a conference. In terms of where like flexibility as like your location, residency wise, it's kind of where you match is where you go. You don't get to choose, like wherever you match is where you go. And then afterwards, there's always flexibility. I mean, my chief and my co-resident are from like Knoxville area. So they're both planning to go back there, and they've had no issues finding jobs. And then as far as me, I don't care where I end up. I just want a practice that's going to mesh well with me and allow me to be the best surgeon that I can be. And, I don't want like an eat what you kill mentality in private practice. So I think there's a lot of flexibility, but there are people who, there's a lot of people who are married and like, well, my spouse really wants to go back and be with family. And so then they kind of limit themselves to the location, and they do well.
Yeah.
Yeah.
It's great to have that flexibility, I'm sure.
There's always somebody who's getting out of practice when somebody's trying to get into practice. So even if maybe for a year you're not in the perfect location, people do well ending up where they want to be.
Okay, that's great. I'm sure great for you as well to just think about it after you're done your residency.
All that hard work.
Yeah, it pays off.
Yeah.
So how do you manage your time and stress in dental school and now residency?
It can be a little bit of dental school was a lot easier. I was able to work out. I woke up in the morning, 5 o'clock or whatever. And then so I would go to the gym, and then I would go to my classes or school or whatever you want to call it. In residency, that is more difficult. I would say on average, we're mandated, so only working 80 hours. And so you have to find time. I mean, they're like on trauma, my alarm goes off at 4:20, and I promise you that every day for the last 2 months, I've set my alarm for 3 o'clock, and I have not yet been able to make myself get up. So working out and de-stressing these last few months has been tough, but I know that it's only for a little bit. So there's always an end in sight.
Yeah, that's definitely a very good way of looking at it. I always think to think of the good, think of why you're in it and the end goal. So that's definitely really good.
Yeah.
And then also in your specialty specifically, is there like an age group that you typically work on, or is it just all ages? Like
patient-wise?
Patient-wise, yes.
Yeah, no, all ages. I mean, I have seen little babies the day they were born, and they were born with neonatal teeth. And so you have to help them out to help the mom out because it hurts when they're breastfeeding, all the way to people who are 100. I mean, there's so much in between. In residency, of course, we do more pediatrics than some of the private practices would do, but that's more kids can be scary when you work on them because things can be perfect and then not perfect very quickly.
Oh, really?
Yeah.
And how do you work on a baby? I've just thought of that. I'm really curious.
Quickly. No. But though for the babies, usually those little teeth aren't real. They're not fully formed. And so you can just take some gauze and wiggle them out and help them out. Or you can have a little baby with a tongue tie that is having some difficulty eating. And so they need a frenectomy. And we'll use a laser and cut the frenum of the tongue.
Okay, so you have to put them to sleep sort of thing, obviously.
If they're a certain age, then we'll put them to sleep, usually with like gas. But yeah, sometimes little babies, you can just swaddle them.
Okay. I'm sure that helps. I bet it's hard for the moms sometimes though to watch.
Yeah, but once the baby gets their bottle again, they're typically okay.
Okay, that's good.
Wow.
So how many hours do you dedicate to your residency per week in terms of studying, labs, that kind of thing?
Studying labs every single day. You are checking labs constantly from the moment first thing you do when you get in is you check the patient. You are writing down any new labs, any new imaging, any new findings from overnight. And then you round and we'll maybe get labs throughout the day. As far as studying, I try to at least read an hour a day. It can be very tough, and sometimes those hours are just like broken up throughout the day or into like maybe like 15, 30 minutes here and there. But you really just kind of have to be organized and dedicated because you have to constantly learn and evolve and grow with the specialty, or else you're just going to be left behind.
Yeah, for sure.
Yeah. And it's really, there's so many new things that are coming out in articles, and there's some great things out there, and it's sometimes, well, a lot of the times very overwhelming because you constantly feel like you don't know enough. And that kind of helps me stay motivated to read a little bit more because I don't want to be left behind.
It's a great motivator. Yeah. A little bit of competitiveness, kind of.
Yeah, a little bit.
So how was the interview process like for your school or your specialty?
For us, it changed because of COVID. So it is all virtual. This year we interviewed 30 people. We had like a 40% increase in our applicants this year, which was crazy. Oh. And Mitchell and I, who's my co-resident, along with my attendings, went through all the applications. We read all of the letters of recommendation, which took forever. Oh. But you pick your people, you interview. The way we do it is you have 4 separate rooms. So there's Mitchell and myself, who are the rising chiefs, and then the other 3 rooms have attendings in them, and then you get 15 minutes in each room. And then after, like, if you're not in one of the interview rooms, then you're in a kind of big breakout room with all the other residents.
Okay.
And it's basically the same way we did it in person, just virtual.
Oh yeah, the breakout rooms. Sometimes virtual makes it a little bit easier, though. I find a little bit less stress in that way.
Yes. And it's cheaper for the applicants. It's just unfortunate because you don't really get to experience the program.
Okay.
And like you're going to spend 4 years there. You're going to move there. You want to know what the hospital system's like. You want to know like what the facility maybe even looks like and what the town is like that you're going to spend those years in. So it's a little unfortunate.
Takes away from that aspect. Yeah. And I'm sure as the interviewer as well, they want to see if they're stressed kind of thing. But anyway. So how would you compare residency and dental school, which is more difficult, stressful? I know you said residency is a little bit more, but do you want to expand on that a little bit more?
Yeah. Residency is by far a lot harder, more because it's you are doing so much more. You are responsible for so much more. You are a doctor now. You have graduated, and when I introduce myself, I am Dr. Linnebur. Yes, I am a resident physician, but you have so much more responsibility. You are doing surgeries. You have more time commitment. And I mean, in dental school, you go to clinic, you go to sim lab, you go to treat your patients later on in your D3 and D4 year, but you don't take call. And that's another big thing. Like call is a really hard thing for some people to get used to, because it's not something that you think will be, well, maybe you will, I don't know. Some people don't think it's that difficult, but imagine just going to sleep and every hour, 2 hours, your pager goes off, or every 3 hours you have to go in and do something. So there's a lot of getting used to and getting ready for, but I mean, dental school has its own hard things because, I mean, to me, undergraduate, like at KU, it was hard, but it wasn't ever like mentally challenging to me. And then dental school was a little bit more mentally challenging, and then residency was even more. So
wow, so each year or each different thing got worse and worse, but it sounds like you're good at managing time and stuff.
I tell myself that.
With that, what are some ways that you relax or manage your workload on those long days?
Recently I have been drawing. I think that like when I have like a moment of like peace, I'll just draw something just to like, cause my mind can go elsewhere. I would like to work out, but I feel like the second I get home, I just want to go to bed. So I don't normally. I'm next month I start neurosurgery, so I'll have a little bit more time. So I'm hoping that I'll get back in the gym. And then I have 2 dogs, so when it's not like freezing like it is in Illinois, I'll take them like try to take them for walks.
I'm sure just working your job, it's its own form of exercise as well. So
you really walk all over the place.
Yeah, so probably take over 10,000 steps a day at least.
Yeah, I used to keep track of it, and then I actually got a Whoop band, and so that always tells me how not well rested and how stressed my body is. So I was like, oh, okay.
That could be helpful though, I'm sure.
Just need to sleep better.
Oh yeah, that's another thing.
Yeah.
So what do you wish you had done differently in preparing for oral surgery? Are there any extracurriculars or that sort of thing?
I think if I was to do anything differently, because I got a Bachelor of Science in Microbiology at KU. I think I really would have tried to do like a minor in business. I really think that would have been one thing that could be really beneficial, because it's not something you think about until like you're getting ready to graduate and go into private practice. But I really don't know anything about business. Yeah. I have some wisdoms and some pearls that people have told me about, but it's going to be a lot of thing for me.
You're probably just so focused on science that you didn't think about that. It's like me, I guess. I wouldn't even thought of that.
Yeah, I never would have thought of that. So that would be something I'd do differently.
Okay. Do you have exams in residency, or how does the setup of work compare to traditional educational setup of dental school?
That's a good question. You don't have exams per se, but every week you have a lecture. You are expected to be prepared for those lectures, and any questions that your attendings ask you, you should know them. And then we do have an annual on-site exam that basically kind of compares you versus all oral surgery residents out there. I think ours is in March, so getting ready to take that. Like in medical school, they call it ABSITE, and we call it OMSITE for oral surgery.
Okay, and that's the one main exam that you have then? Because I heard in dental school, there's like a bunch of exams, so maybe that's...
Yeah, and dental school are different. Mine was quarterly, which was one thing that was hard for me because KU was semesters, and then I went to quarter, and I was like not prepared for that fast pace. But you also take like your national boards and licensure. So you have to take boards for like a test for that as well. So.
Oh, wow. So I didn't even think about that. All the dental schools are different in that way. I didn't think like quarterly was a thing.
And all the different licensures that you get. So like my licensure is credits, which means that I can pretty much practice almost anywhere, but I can't go to Florida unless I retake the licensure exam, which I would never do.
It's hard.
It's just, I'm so past that and that stress. Something would have to be really worth it for me to want to retake a licensure exam.
So in residency, do you go straight into working on patients, or is there like a year of not doing it or anything?
Day one, you are on call and you are in the emergency room. You are scrubbed in and assisting, and you kind of just build your way up. You obviously start off by watching, see one, do one, teach one, kind of the old school way of learning things. But nope, you are not pushed in there, but you are guided into the world of patient care.
Oh, so kind of pushing there. In dental school at the end of the 4 years, did you like start working on patients at least? So you got a little bit of a...
In dental school, I think it was like the very end of my second year was when they brought us over to the other campus to start at least getting like experience with patient care. And then in your third year is when you start working on patients. And then by your fourth year, you're mostly only working on patients and you have a few lectures here and there.
Okay.
Yeah. So you've been working on patients for a while, before you get to residency, it's just a different thing you're working on, kind of.
Yeah.
No more fillings or crowns or root canals or all that stuff.
It's more of the oral surgery type of thing. Yes. With that, I'm kind of curious, what is the layout of residency? Like year by year, what do you do?
So, and here, maybe I go back in this.
I saw that.
So really this kind of breaks down, and every single residency is different. If you're 4-year, 6-year, they're going to have a different layout and a different map. And this isn't even fully correct for ours because we have 2 4 years instead of just 1. But the OMFS means that you're on service or you're doing oral surgery. And then in your PGY 2-year medicine, you do general surgery, you do ICU, you do 5 months of anesthesia, and the last month is pediatric anesthesia. And then in your 3rd year, you're doing general surgery again, but that's your trauma, and you do neuroplastics and ENT.
Okay, then it goes month by month?
Yep, month by month. So currently, I'm like right here. This is where I'm at.
You're almost done.
Almost done with trauma.
Do you like this sort of laid out with the month by month?
Yeah, I mean, it makes things easy because you have a plan. But I guess that was just my stuff. But you have a plan and you can kind of look forward to like the next step. Yeah,
that's for sure. Because do they give you that sort of template, or did you just create that?
No, they gave it to us.
Okay. Yeah. That's nice to see the end then. Like if you follow it step by step.
Gives you something to look forward to.
With it being month by month, does that make it sort of crammed and hard, like in that way?
No. It seems like the right amount of time.
Okay.
Yeah. It's not
nice. I know sometimes for me, some classes will still feel crammed, and I know it's like multiple months now looking at that.
Yeah, but it's different because you're doing like exams and testing and that kind of stuff.
Oh, and you're
like on trauma, I'm not getting, I'm getting quizzed every day by the attendings, or I'm hoping that I know enough. So the resident that I'm on with trauma like thinks that they can trust me or whatever it is. So I'm constantly like studying and making sure I know enough, but it's not an exam that I have to sit down and take. Okay. But all the information, so shock in a patient, like hemorrhagic shock, like the classifications for that, I'm applying that knowledge during trauma, and then I'll be tested on that knowledge on my site. So that's kind of how it plays into each other.
That's kind of a good way of doing it as well, because instead of sitting down and do tests, I know a lot of people have test anxiety or stuff like that. You kind of just get tested like each day on it.
And I'm not a good test taker, so if I only have to take 1 a year, that's great.
Does that make it stressful for just doing 1 a year also, though?
It can be like towards the end, because then you're like, oh, I have a whole knowledge that I have to like be tested on. But every year, every day, you're learning more. And if from a PGY 1 to a PGY 2 to a PGY 3 and so on, you're going to learn more and more. So that test theoretically should get easier and easier each year.
Yeah. Do you like teaching?
Yeah, I did not think that I would. I did not think that I would like the teaching aspect of residency, but I really do. I like being there for my interns, and if they need me, that I'm there. And I do hope to maybe one day be in an academic setting, but who knows?
So the internship, is that required for the program, or is that just something else?
Yeah, it is not required. There are definitely people who right out of dental school apply in their 4th year and then match. But like I said, I did not. I I definitely had some self-doubt. I had some naysayers that I let get in my head. So I was like, no, I'm not going to do it. I can't do it. And then I was like, no, of course I have to do it. So then I did the intern year to basically give myself a whole year to take that exam, which is a tough exam, at least for me it was, and then apply to residency during that time.
And does it help, like, in terms of getting into the residency for taking the internship?
Yeah, I don't know. I think you could find people on different sides of the coin on this. I know that Mitchell and I, my co-resident and I, we were talking about this during interview season, and I think that it's becoming more common for people to do internships because the specialty of OMFS is becoming more competitive, and a lot of people do like people who've had a year under their belt. They're not so wide-eyed, and they have a little bit more confidence. But then you also have some people who don't like that because maybe they learned some bad skills or some bad habits at a place, and they don't want to have to unlearn that. So I think you could find anyone that's going to be on different sides of the coin. But I think that it's a huge benefit. And I think that you learn and you grow a ton in that year. And if anything, that year allows you to know if that's what you want to do for the rest of your life. Because if that year was hell and you can't get through it, don't apply for 4 or 6 more years.
Yeah. And it's a 4-year program?
Mine is, yeah.
So how many years in total that is your school, like with dentistry and undergrad and then now the residency?
Oh my gosh. So undergrad, that's 4 years. And then you have 4 years of dental school, and then you have an intern year, and then you have, so 13 years.
Wow. And then I guess for you, definitely worth it in the end.
Yes. I, 100%. I think that it is something that I love to do. It's something that I will love to do. I will enjoy going to work, and I'm very happy that I chose oral surgery.
That's great, definitely.
Yeah.
On a slightly different note, are there any extracurriculars that you did before dental school that helped you with it? That helped you
getting into oral surgery?
Yeah, oral surgery and also dental school, just in general.
I did a outreach group with Vita Volunteer. I did one of those. I really enjoyed it, and I always recommend it to people. I think that it was a great experience, and that was positive. I did a lot of community service in undergrad. I did a ton. I think I did Big Brothers, Big Sisters, Girl Scouts, shelters. I did kind of whatever it was. And then really just shadowing and getting in there and having someone that could write me a letter of recommendation. That helped a ton. Getting into dental school and getting into residency. Because your letters of recommendation mean a lot when you're applying.
Yeah. And right now, I'm sure it's hard for some people to connect with professors in that way or to get those. But that's why I guess it's important to do those other extracurriculars.
Yeah, we saw that in like the application cycle, just because everything's virtual and things were not online. So we took that into consideration for sure.
Okay, that's great to hear as well.
Yeah.
And then I think I'm not seeing any more questions, but I do have one last question. Do you have any pieces of advice or just information that you'd give to anyone who's interested in this specialty or interested in doing what you're doing?
I think that the best piece of advice is that if you want to do it, then stick with it. Don't let somebody tell you that you can't. Do what you need to do. Do the hard things. If that means that you need to study for an exam, or you need to, I know it sounds so silly, but you need to not go out that one night or something, like,
Yeah.
Those small little things that you don't think matter end up mattering. Mattering, is that a word? Making a difference in the end. And so if you want to do it, do what you need to do, and make it happen, and find a good support. Like, it is amazing how much of a difference it can be. Like when I was going through this, I had the family friend, but then he moved to another state. And so I didn't really have like a mentor or somebody that could like walk me through it, and answer those questions that I didn't really know. So that's part of the reason I like do these things and why I am actually on social media, because I feel like that gives a safe space for people to reach out and ask questions, and it doesn't matter how silly they are. But I didn't have that, and so I always wanted to make sure that other people would have someone, even if it was a dumb question. So find a mentor, find somebody that'll help you get what you deserve and what you need.
And that's amazing how you have that platform. People just reach out whenever. Great to think of that.
I don't always answer right away, but I'll get to it.
You're a busy life. You have a busy life right now. It's fair.
But I had a question. Where are you guys at that put on this fresh shadow dentistry?
Like where
are you guys at in school?
Oh, I think everyone's just all over. I'm in my second year of undergrad. I think so are the like people who made fresh dental shadowing.
Yeah.
I know everyone's different, so that's me personally.
That's awesome. And you guys are just kind of all over?
Yeah, like I'm in Canada, and then I know a lot of people are in States and stuff, so it's kind of cool.
Yeah, that is awesome.
Platform to meet people.
Yeah.
So I just want to say thank you, everyone, for coming and watching. And thank you to Dr. Alexis Linnebur for her wonderful presentation and answering all those questions. It's kind of like an interview, all those questions being thrown at you, but thank you.
Well, I had a good time. Like I said, this is my email if you really like to email, or if you just want to send me a message on Instagram. I put my Facebook on there just because I think everyone has Facebook, but I'm not really on that. I don't care what it is. If you have any questions about anything, I will be more than happy to try and answer them. And then if I don't think I can, I have a bunch of good friends in other places that hopefully I could get you the answer that you need.
Perfect. Thanks so much.